What a great question. Let's talk through it. Essentially, a CTG is a way for us to gently check in on how your baby is doing by listening to their heartbeat, monitoring for contractions, as well as fetal movements. A CTG can help us understand how your baby is coping so we can support you both during pregnancy, labor, and birth. A CTG is a common way of monitoring your baby's well-being during labor. It works by placing two belts around your abdomen. One records your contractions and the other tracks your baby's heartbeat. A clicker is also provided, which is called a fetal movement marker. This determines movements in utero. The information is then displayed on a screen or paper trace so midwives and doctors can see how your baby is coping and provide them support if concerns arise. For many women, CTG monitoring can feel reassuring, offering a sense of safety and guidance throughout labor. At the same time, a CTG can influence the way labor and birth unfold. Continuous monitoring often requires you to stay close to the machine, which may limit freedom of movement and comfort. This restriction can affect the positions you use, your ability to mobilize, and even how you emotionally experience labor. Movement in labor is known to support progress, reduce pain, and promote a positive birth experience, so being confined to one position can feel quite challenging. Research has also shown that the routine use of a continuous CTG in a low-risk pregnancy does not always improve outcomes as compared to intermittent monitoring. For some women and babies, a CTG is essential and recommended, but for others, it may not be necessary. Understanding the benefits and limitations allows you to make an informed choice about monitoring that supports your preferences and values for labor and birth.
Continuous CTG provides several potential benefits. Notably, it has been linked to a significant reduction in neonatal seizures compared to intermittent oscillation, though these events are rare. The continuous data offers an ongoing objective record of fetal heart rate and uterine contractions, which can help in real-time clinical decision-making and provide valuable documentation. Many women and midwives find reassurance knowing the baby's condition is closely monitored throughout the labor. One key advantage is a slight reduction in the chance of neonatal seizures. This suggests that CTG might be slightly better at detecting early signs of fetal distress compared to IA. This is particularly valuable in high-risk pregnancies where the likelihood of complications is significantly elevated. However, it still plays an important role in low-risk pregnancies. So although neonatal seizures are rare, reducing the chance your baby might experience one is a meaningful benefit. While the study did not find significant improvement in outcomes like stillbirth or brain injuries, CTG's ability to detect subtle changes in the baby's condition adds an important layer of reassurance for both you and the healthcare provider. That said, for most women with low-risk labours, this benefit is relatively small, so routine CTG may not be necessary for everyone. Furthermore, from a woman's perspective, continuous monitoring can offer reassurance by allowing the mother to hear their baby's heart rate and feel a sense of safety. A body of evidence has demonstrated that CTG can actually improve surveillance in complex or evolving labours, which may refine fetal safety if implemented properly. CTG is not routinely recommended for low-risk births, but again, its comprehensive nature can be reassuring to both you and your midwife when managing labour. Finally, evidence shows that continuous electronic fetal monitoring or CEFM can improve your comfort and sense of security. Many women feel more supported and reassured knowing their baby is being closely monitored. It is particularly helpful when labor begins as it can catch issues that occasional checks might miss. This continuous data enables timely interventions, helping keep the baby safe, especially if any risks arise. This monitoring also helps your midwife make faster, more effective decision-making when necessary, contributing to a smoother labor experience for you and the delivery of your baby.
Despite the benefits, it's important to understand the possible disadvantages of CTG monitoring so you can make an informed decision about what you want during your labour and birth. A range of studies have found that there is a higher risk of medical interventions being needed when CTG monitoring is used. This includes caesarean sections and instrumental births, which include forceps and vacuum deliveries. CTGs can sometimes provide unclear and inaccurate results, and not always because your baby is distressed. These unclear readings can lead your midwives to recommend interventions that may not necessarily benefit you or your baby. This means that women can undergo procedures that may not have been necessary but have been flagged by the CTG. CTGs are also deemed by many women as restrictive due to the belts and wires, restricting movement, positions, water usage, and other management techniques. Many women report that the use of CTG monitoring makes them feel bothered, unable to be comfortable and move, and forced into positions that are less helpful for pain management. The lack of mobility can have an impact on how you manage your pain and how comfortable you are. The equipment can also feel intrusive and uncomfortable as a result of the belt slipping, midwives having to adjust the monitor, and noises from the machine that may affect your flow of labour. Several researchers have highlighted the emotional impact of CTG use, increasing anxiety and stress. The sounds of the machine and unfamiliar medical terminology can heighten a sense of worry, fear, and non-reassurance. Many women also felt as though their midwives focused more of their attention on the machine rather than their own voices and experiences, leaving them feeling less confident and dismissed in their labour experience. This lack of attention also led many women to feel less supported and alone during labour, as midwives may spend more time interpreting the data from the CTG and less time offering reassurance to spend one-on-one time with women. Research further shows that many women are not fully informed about CTG usage and its potential downsides. Many women are not aware that they may be able to decline CTG monitoring in some circumstances, or that intermittent auscultation is an option. So stay educated and be aware that you can say no to anything you aren't completely sure about. Across multiple studies, it is found that CTG monitoring for women with low-risk pregnancies does not appear to impact health outcomes for mothers or babies, in comparison to intermittent auscultation. Using CTG monitoring in low-risk pregnancies can often lead to more unneeded interventions and restrictions without benefit. If you have any questions about any of these risks, ask your doctor or midwife and they'll be happy to give you some more information.
Let us talk about alternatives. When it comes to monitoring your baby during labour, continuous cardiotography is not your only option. On the contrary, women who have no identified risk factors for fetal compromise in labour, also known as a low-risk pregnancy, are recommended by organisations such as the World Health Organization, the International Confederation of Midwives, and the International Federation of Gynecology and Obstetrics to participate in another form of fetal monitoring called intermittent auscultation. Intermittent auscultation involves listening to your baby's heart rate at specific intervals. The time intervals vary depending on the stage of labour you're experiencing, with monitoring happening immediately after contraction every 15 to 30 minutes in the first stage of labour and every 5 minutes in the active portion of second stage of labour. Your midwives can perform this with a pinhole stethoscope, a handheld Doppler device, or through intermittent use of a cardiotachography transducer. Let us now take a look at what you can expect with each option. Pinards, also known as needle stethoscopes, are non-electric devices that are trumpet-shaped and placed on a mother's abdomen. The midwife is then able to listen to your baby's heartbeat at the flat end of the pinard. With this device, you are unable to hear your baby's heart rate, but you can definitely ask your midwife to inform you if you would like to know. The next device is likely something you're more familiar with. Given its common use during antenatal appointments, the Doppler is a handheld device that is placed on a mother's abdomen with gel applied to the underside of the ultrasound transducer. This allows the ultrasound beam to travel from your baby's heart to the transducer without interruption. With this device, you can listen to your baby's heart rate and request the exact reading from your midwife if you would like. The final option is a CTG transducer, often associated with continuous monitoring but can also be used intermittently. In this situation, the transducer, similarly to the Doppler, is placed on a mother's abdomen for short periods, so you're not connected the whole time, allowing for freedom of movement between recordings. This allows you to both hear and view your baby's heart rate. When comparing the three methods, moderate quality evidence as classified by Martis et al. 2017 states that both the Doppler and intermittent CTG transducers identify more abnormalities. However, this leads to an increase in cesarean sections compared to using a pinard. Let us discuss some advantages and disadvantages reaffirmed through the experiences of mothers. The benefits of intermittent auscultation include reassurance of hearing and knowing your baby's heart rate, as well as the ability to experience freedom of movement. Both of these benefits are portrayed by Anna, who experienced intermittent auscultation in labour, as described in a qualitative study by McLellan et al. 2024. She states, "I was happy to have the monitoring because I wanted to make sure the baby was doing okay, but I was also really happy that I didn't have to be stuck to the bed, that I could move around, and that I could still do all of that while I was in the water as well." This showcases her personal experience, allowing her to feel reassured by listening to her baby's heart rate, as well as her happiness that her movements were not restricted. On the contrary, some women describes feelings of anxiety and annoyance in the disruption of their labour. Participants in a qualitative study by McLellan et al. 2024 report that intermittent auscultation disrupted their labour due to the expectation of communicating with the midwives about the contractions or the need to change positions to allow the midwives to carry out intermittent auscultation. While it was stated that listening to your baby's heart rate can bring reassurance, for other women it can bring anxiety. As established in a qualitative study by Fox et al. 2024, participant 78 describes their experience of intermittent auscultation, stating, "I found it anxiety-inducing every time I saw the midwife with a Doppler in her hand. preparing to listen. I'd worry that she'll find something abnormal. My lovely, natural, understood birth might end there. This highlights the diverse needs of women and how one's experience might differ from that of another. The key thing to remember is that as a low-risk pregnancy, there are options for you to decide from. It is important that you choose an option that best supports you during labour, selecting something that not only promotes your baby's health, but also ensures a positive birthing experience for you. If you are unsure about which option is best for you, do not hesitate to discuss the different options with your midwife.
I'd like to share what research tells us about how women feel when CTGs are used during labour. Women who have experienced continuous fetal monitoring with a CTG monitor found that the midwives became too focused on the CTG, making them feel like it became more important than them. One woman mentioned that she felt invisible, as the doctors were mainly focused on the CTG trace, making it feel like they had no trust in her body or her baby. When feeling invisible, women described feeling a lack of privacy when the CTG was on, as it invited more people into the room. Loss of freedom of movement and autonomy is a common limitation women experience when having continuous fetal monitoring. Women stated they felt tied down, hooked up, stuck, attached, and tied to the bed. Women felt as if they were restricted from being able to have freedom in their movement, be able to use water as a pain management tool, and be able to use physiological birth tools which needed an upright and movable position. Unable to move and change their positions freely in labour led women to feel a decreased sense of autonomy. However, women who used wireless CTG monitoring stated they felt an increased freedom of movement and sense of comfort. A double-edged sword is what CTG monitoring has been called, as for some women it could be reassuring but anxiety-inducing at the same time. Through research, professionals have acknowledged that CTGs provide a false sense of security. Women who have experienced a sense of anxiousness when the CTG lost contact, the fetal heart rate slowed down, or dropped out. One woman mentioned she found the CTG reassuring, but with the monitoring she ended up feeling like there was a heightened risk amongst the midwives and OBs, which for her created a sense of stress where she was therefore unable to focus on her labour and birth. Although other women felt as if they were able to relax and not worry about their baby when the CTG was in place, as it became a safeguard for them. Women who had positive experiences with CTG monitoring were those who felt reassured, were able to move freely, were in control, respected, and empowered. However, when midwives put on the belts and monitors devices, inferred consents and trust were implied, and therefore women were not actively involved in the decision-making process. One woman mentioned she wishes she had known that the CTG monitoring wasn't compulsory, or that there were other fetal monitoring options available. This is confirmed by research which shows that women were unaware that they had other options or even the choice to be continuously monitored, as was often introduced as fact rather than an intervention. We hope that being able to hear and understand what a CTG is, what the benefits, risks, and alternatives are, and see other women's experiences can help to support you in making an informed decision about the use of CTG monitoring in your labour, so that your experience is one that will be safe, respectful, and empowering for you. If you have any questions or concerns, please feel free to ask your midwife.